We get lots of questions, even at the Wellness Hour, about the cost of dental implants. So what affects the cost?
So great question. In fact, I actually brought a little cheat sheet so I wouldn't miss anything, because there are a lot of things that go into the cost of dental implants. I have a list of 9 different things that can affect the cost of a dental implant. The set of teeth that go on top of the dental implants, let's say. The very first thing is the implant itself. There are hundreds of implant manufacturers out there. They all claim to have one thing or the other. We do use the gold standard when it comes to the full arch fixed set of teeth implant. Neodent implant is the gold standard.
Okay.
They have over 60% of the implants out there for this are Neodents. We do so many of those implants that I get a discount on them because of the volume of patients that I see.
Okay.
They pass a discount on to me, I pass that on to my patient. So first thing is just the cost of the implant itself, okay? So the next thing in there is the doctor involved. What I mean by that is, do you have to go to a surgeon to have one thing done and then to what we call a restorative doctor or general dentist to have another thing done? In our office, we do everything right there in-house.
So typically you would go to like at least 2 offices to get this done.
Correct. And with that, you have overheads to pay for in both those offices. Since we do everything in one office, we can help keep those costs down for our patients that way.
Okay, so it's one doctor, one fee.
Doctor, one office, one fee.
Okay.
Correct. Yep.
What else affects the cost?
The next thing is the surgery itself. So what I mean by that is some patients come in with no teeth. Some people come in with every single tooth in their mouth, even their wisdom teeth. Some people need more advanced surgeries. In my office, I don't try to nickel and dime the patient. I just charge one fee for the surgery. Even for my more advanced implant procedures, I'm charging you to give you a set of teeth in our office. Okay. So the surgery to me, doesn't matter if I'm taking out 32 teeth or 2 teeth, we're gonna take care of you in the best way that we can,
That's
okay?
Nice. Okay.
So the other thing in our office that we look at is a lab bill. So what that means is when we make these, we have the implants that we talked about earlier, but then you have to put teeth that screw down on top of that. These are all custom-made teeth. They're not something that we're getting out of a Cracker Jack box. It is not inexpensive to make those teeth. Since we have our own in-office lab, I don't have to pay that extra outside bill for our patients.
You said you literally have a printer that makes the teeth.
When I say next door, I don't mean in the next, I'm talking the next room over.
Okay.
Yes, the printing, all that is done in the room next to our surgery suite. So it's all done right there in-house. If something happens after surgery and something doesn't work right, we don't have to call some lab hours away or even states away to get it fixed. I literally walk over and say, hey, can you reprint this in 10 minutes so I can make sure this patient gets their teeth before they leave here?
Is that right? Okay.
I have never once sent a patient home without a set of teeth. Fixed. Fixed onto their implants.
Meaning that don't come out.
That don't come out.
Okay.
Yes. Okay. So again, lab bill. Again, since we have our own lab, we can keep that cost down for our patients. Okay. The next one, and this is a big question, probably the biggest question that we get is insurance. Will my insurance cover this?
Yeah, good question.
You know, it's a fair question, and I like to tell patients that in our office, we're going to work with any insurance that we can. We are going to do our best to maximize your insurance benefits to the best of our ability.
So you have people that try to get every penny out of their insurance?
We have multiple people in our office that are working truly to do that for you. The average that you're going to get out of dental insurance is about $1,500.
Okay.
And so keep that in mind if you're doing this. Just think, I can get roughly $1,500 out of it. Now, we do have some Medicare plans that are starting to pay for some of these. But the first thing it starts with is an evaluation. Come in, let us evaluate your condition. Then we can look and see if your plan actually may cover some of this. We actually have some medical insurances that we can look into that might cover this. But it first starts with an exam.
So like how much, like on the Medicare program or the medical insurance?
So Essence is a program out of Missouri that it's through Medicare. It's an Essence policy that can cover up to $5,000 or $7,000 depending on what policy you have. So give us a call. We can help.
You just need a diagnosis first.
You need the diagnosis first.
Okay.
Yes. Once you get that diagnosis, we can help you with that.
Whether it's covered or not.
Absolutely. Yes. Yep. So,
okay. And Medicaid doesn't cover this at all.
Medicaid doesn't cover it all, unfortunately. So
now, but you say people are financing this.
Yeah. So again, I would say the vast majority of our patients finance to some extent on this. Maybe not the whole thing. They may come in with maybe part of it's insurance, part of it's some money that they've had in savings, but part of it they finance.
And you have to have decent credit to get that. It's not like they're making payments to you.
Exactly. We don't finance it ourselves. We do use the third-party financing. So we do run their credit and we make sure that they can get a financing approval. But yes, the majority of our patients are financing to some degree, for sure. So the next thing that affects the cost is, what are the teeth made of? And we do have multiple options in our office for our patients. That first one, which is maybe a little bit less expensive, the teeth are made out of, let's call it a plastic. It's not necessarily plastic, but it's a softer material. It's a good jump-off point. It will give you something that's fixed that's going to look good, but not great
When you
immediately.
say fixed, mean they don't come in
They
and
don't
out.
come out. They are not coming out.
They can last if you take care of them.
Our goal is that they last 2 to 3 years.
Okay.
And when we want, the other option that we have is what we call zirconium. This is the material that is going to look absolutely beautiful.
That's what you like the most.
They look the best. They won't fade. They won't chip. They won't stain. They won't break. We can guarantee that on that zirconium material for sure. We can always take that first material, that plastic material, and convert it in the future. So we have options for our patients depending on the type of material. Now again, that plastic material, it's kind of the same material that a denture is made out of, slightly stronger than a denture. We always want to be thinking of moving our patients either in the very beginning into the fixed zirconium, or over time moving them to that fixed set of screwed in zirconium teeth. It's the best looking and longest lasting that we can give our patients. And again, that also helps with, that's why I can give you a warranty with that. We'll stand behind their zirconium product because I know it's the strongest, best looking material that we can give you, okay? The next thing that we look at is patients are also looking at, what are my other options? Can I do a snap in, snap out? We've been talking about all this is fixed teeth, meaning they don't come out.
So snap in, snap out.
So a denture that can come out and you can set on your counter at night before you go to bed. That definitely is a less expensive option for our patients.
You don't like them?
I don't like them. We used to do them in the past, but with new technology that we have, I can make you a much better set of teeth that you're going to be happy with. And in the long run, they're going to be cheaper in the long run to have a fixed, screwed in set of teeth. Why is that? You might think the denture up front is cheaper, and it is. But you're going to have annual cost to make sure that denture doesn't come in and out. Every year, roughly $1,000.
Okay.
And that denture is going to last no more than 5 years. Somewhere between 2 and 5 years, you're going to have the whole denture
So for the
replaced.
snap-in teeth.
The snap-in teeth, you're going to have to redo the denture about every 3 to 5 years.
Now, why is it seems like the new dentists all do those?
It's easy.
Is it easier?
It's easy. It's a good starting point for somebody to jump in because it's less accurate. You don't have to be as efficient. You don't have to be as accurate with your implant placements. So it truly is easier for the doctor.
But you would not recommend that?
I do not recommend it. We don't even do snap-on dentures in our office anymore. Our job is to take you out of a snap-on denture and put you into a non-removable, fixed 2-implant set of teeth.
Okay, good.
Okay? And the last thing on here that I would talk about is experience and training. So what I mean by that is we do roughly 2,000 implants a year in our office. The experience of the surgeon also helps the patient with cost. If it takes me an hour and a half to do a surgery that takes somebody else 8 hours to do, just do the math. They probably have to be charging you more in order to pay their bills. Also, it's more efficient for my patients. You're going to have less times to come back into the office because you're going to have less mistakes, less issues, less
And you're
headaches.
doing this on a computer too. So does that make for less follow-up visits?
Everything we do now is on the computer. Yeah, it's the new technology has allowed us to take the digital world and all the things that we can do, 3D printing, 3D milling, all this stuff that we used in rocket technology. Actually, one of the products that we use in our office was actually developed for NASA to determine the differences in the wings of the shuttle so it flew perfectly accurate. If it was good enough for NASA, I think it's good for our implants.
Okay.
So we are using technology that is revolutionizing what we can do.
So when a patient calls your office, and we talked about this, they always want to know how much it is. It's just not that simple, right?
It's a loaded
But you
question.
see it all over
Yeah.
Google, all
Yes.
over online.
Yes.
And you say that oftentimes they're just quoting the cost of that little tiny implant.
Yeah.
It's like misleading.
It's a bait and switch. A dental implant costs this, but dental implant does no good without a tooth that goes on top of it. So it's fair to ask these questions because when you see these ads on Google or Facebook or wherever you might see them, they're more often than not misleading. They're not giving the full picture.
So there is a catch to this. I guess they just have to come in for a free
all
consultation.
starts with the consultation. We can give you a better idea of what your true costs are when you come in and have a consultation with us, for sure.